beautiful Tampa, and today we are at 360 Surgery Center. So excited to be here with Dr. Tali Arviv. Welcome to the show, but thank you for welcoming us here. A wonderful facility that you have. What made you decide to have a surgery center?
Oh, that's a great question. I'm so glad you came.
Thank you.
I actually have a 3-location med spa, and when I realized that there's only so much we can do non-surgically, it was time to open a surgery center to accommodate those patients with trusted surgeons that we can bring in and bring the patients in and make them feel comfortable to have whatever procedure they want done. But the main reason we opened the surgery center is because we like to treat keloid patients. So it's been something that we've been doing for over 10 years. We treat patients that have keloids anywhere on the body, and we're able to deliver a service called superficial radiation therapy, which is really an important part of removing keloids.
Now, if someone doesn't know what a keloid is, what happens is when the skin heals on some textures of skin, it actually protrudes out, it bumps out. And
that's right.
Some of the images that you were showing me sometimes can be painful for patients. It's not just cosmetic. Sometimes it can affect your actual functionality.
Absolutely.
Correct? So why do they appear? Like, do you know, like, the science behind it? Like, what causes them in the first place?
Yeah.
Scar tissue, I guess,
right.
Is what it is?
Okay. It's an overgrowth of scar tissue. So it could be from just patients that are prone to getting keloids genetically. They might get a piercing, or they might have some type of trauma. You can get it just from ingrown hairs or pimples that, because of the healing process of the body, they don't heal well, and your body just continuously produces those collagen fibers, but not a nice organized collagen the way you normally see a good scar heal, right? Normally it just heals nice and flat. You still can see the scar, but it doesn't stick out. In keloids, those collagen fibers are bundled up and swirled up, and they're just abnormal. And that's why you have that protruding skin lesion.
Do they sometimes cause people pain? Are keloids sometimes painful, or just?
Yes, so patients complain of pain, they complain of itching, even can cause tension where you have mobility restriction. We had a patient that, had a pretty bad keloid on his neck from it was like a ski accident. And, he had problems mobilizing his neck. He needed to remove the keloids, do skin grafting. He was even developing some infections under there. So.
Oh my goodness. But you specialize in it. Like, you're really good at it, right?
Yes.
Like, that it's something that you take to heart. You want to help your patients, right?
Absolutely.
And you take pride in, like, the before and afters, right?
We do.
It's like life-changing for a lot of people. But they think, at least to my knowledge, sometimes people that I know that have had keloids, they don't know that there's anything that can be done. They just feel like, oh, it is what it is, and I'm stuck with this for the rest of my life. They don't know there's help. So that's the one particular reason, doctor, that I wanted to come down and talk to you, because I was all excited about it. I was like, wow, look at what you're able to do. I see the results, right?
Right.
What is the process? How does someone come into your surgery center specifically for keloids? Walk me through the onboarding process. What's it like?
Okay.
Do they send you a picture ahead of time and say, doctor, can you help me? Or
absolutely.
Okay.
We get a lot of patients from all over the country. Part of the reason is not a lot of facilities offer superficial radiation therapy. So we get a call. Normally those patients can't physically come in. So we'll either set up a Zoom consult, or if they, nowadays with time, right? Time. We don't have time. They'll just send over an image of, hey, this is my keloid. Can this be removed? Will I be, how much is it going to cost, of course, is the main question.
Okay.
And we try to make it, of course, super affordable and help these patients out as much as we can. Some keloids are extremely complex and require our reconstructive surgeon, Dr. Abdullah, to step in. And so depending on how complex and how many keloids the patient needs to be removed, we would send them a quote based on that, and then and some financing options, of course.
Oh, that's very kind.
If that works, then if they're from out of town, we expect them to stay a total of 2 nights.
Okay.
So they would come in on day 1, they would check in, we'd get them into the OR, of course, pre-op admissions, and then we would get them into the OR where we would operate. on the keloid, and then they would get bandaged up, and then the next day they would come in at a specific time to do the superficial radiation therapy.
And what is that? You have a very specialized piece of equipment. What is that?
Yeah.
Okay.
So the SRT device, it's kind of like doing a little x-ray, and it's very superficial. People always have this hesitation about radiation therapy, right? Oh, it's radiation, it's bad for you, right? Which, you know, we have a lead-lined room, so it's kind of like getting an x-ray, but the good thing is it's very superficial. So we're only radiating those top layers of the skin. We're not going deep into the other organs or other parts of the body.
And there's 7 layers, right? 7 layers of your skin, is that it?
Yes.
I try to remember in health class, I think of the epidermis and the, right, there's all the, right, the fascia or whatever, I don't know, but so you're going just superficially on that part.
Exactly.
Okay.
Right. Just kind of into the dermis.
Okay.
Sometimes, you know, sometimes you get a little hyperpigmentation, which is something where you get a little discoloration after the treatment, kind of like getting a sunburn. But once it's fully healed and you give yourself some time to heal, you know, you have a nice, smooth, flat area of your skin that you treated, and most patients are happy. They're able to regain their confidence, because it can definitely, you know, affect your self-esteem. You're self-conscious about it.
People stare sometimes,
exactly.
because they just don't, they don't understand, right? So, but it's more important, not just for cosmetic reasons, but also, like you said, they could be painful, they can itch, they can affect mobility. But if you just want to get it done for your own cosmetic reasons, even if it's not bothering you, go for it, right? Because there is help now.
So we can do most keloids under local anesthesia here, but there are situations where if the keloid is more complex, you might have to be under general anesthesia or IV sedation. So depending on the location and the complexity, we determine what type of anesthesia you need.
What are some of the other things besides keloids that are done in the operating room here?
Oh, we do everything from head to toe. So all cosmetic surgeries, whether it's, you know, eyelids, facelift, neck lift, we do skin reductions, we do liposuction, all the breast procedures, augmentation, lift. We do fat grafting to the breast. We get a lot of women who want to remove implants these days, tummy tucks, of course. So everything from head to toe. We actually have a great surgeon here who specializes in lipedema patients, and he has amazing results. So this is where you would do your radiation therapy. Our radiation tech will come in, she'll set you up, put everything on that you need. So if you maybe went to another surgeon and you are prone to keloids, and maybe you did your breast reduction and you have, or a tummy tuck scar, and you want to prevent that keloid from coming in, you can just get a quote for only doing the radiation therapy with us. So that way you have a nice cosmetic outcome after your cosmetic surgery.